Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, we are pretty jacked up to have you here because we're bringing some very exciting conversations with leaders that are painstakingly changing and shaping the future of healthcare. And we are just very passionate around healthcare innovation, leadership, and access. And if it's your first time tuning in, let me just sort of take a quick step back and share a little bit more about what we're trying to really get done here. And our focus is bringing real stories of innovation to life. And what does that mean? That's people that are in the trenches, getting stuff done and giving them the opportunity to share within our platform, within our community, to share their stories. And if you haven't checked out any historical interviews, make sure you hit the subscribe button now so that any of the new interviews come directly to your inbox. And we've got just an amazing action-packed year of incredible new content, some phenomenal speakers that are coming in. So make sure you get things checked out. Our field is continuously evolving, and it's critical to have leaders that are able to envision the future differently. And they embrace innovation and they address pressing challenges and they break down barriers within healthcare accessibility. And our next guest on the show is one of those leaders. So Luis Suarez is the CEO of Sanarai, and he's not just any innovator. His story, his mission really touches the lives of countless individuals within the Latino and Hispanic communities, and where access to mental health care remains a challenge. And according to the National Alliance of Mental Illness, there's a stark number that reveals that there's a really big gap in care. Only 35% of Hispanic and Latino adults with mental illness actually receive treatment that they need. And there's a variety of hurdles, which we can talk about today, but some of them include, significant language barriers and a lack of health insurance, often deterring, Spanish-speaking individuals from really seeking the help that they deserve. And Luis is someone that was moved by his own, personal experience and saw the stark need that his community faced. And he founded Sanarai to directly address these issues. And Sanarai is I don't know how else to say it, but it's a beacon of hope for accessibility. It's a non-clinical platform that connects Spanish-speaking adults with mental health professionals from Latin America, ensuring services are provided in their native language. And remarkably, Sanarai's platform is designed so that patients that don't require health insurance to actually receive and access these vital services. So he and his team are really sort of paving the way for more inclusive healthcare technology. And it's also in just ensuring that no individual is really left behind due to language or financial barriers. So we're very, very lucky to have Luis share more about his journey and the incredible work he and his team are doing. So Luis, it's great to see you and welcome to the show.
Thanks for having me, Michael, and for that introduction. Very excited to be here.
Yeah. So share a little bit about your story. So you grew up in sort of Mexico City, and talk a little bit about sort of the transitions of as you're making it, here to America. I know you've done your postgraduate degree work here in the U.S. and share a little bit about your story. I think the audience would love to hear about it.
Of course, yeah. So I'm originally from Mexico City, came to the US to do my MBA. I went to Duke University for that. And after I graduated, I worked in management consulting for 3 years, mainly focusing on digital transformation and M&A work while I was there for just general strategy and operations and management consulting firm called Kearney. And in 2020, I was looking for mental health support like other times in life. And I was struggling to find someone that I could speak Spanish with and that I could fit in my schedule. So that's when I realized the big gap that you mentioned at the beginning.
Yeah.
And, like 10 percentage point difference in treatment rates for Spanish speakers, and also the fact that only 5% of mental health professionals in the US speak Spanish versus 13% of the population that speaks Spanish at home, and then that within itself makes it 3 times as hard to get behavioral health services in Spanish. So just like realized that this was a big problem, and decided to start Sanarai back then with a mission to improve the access of this community to high quality mental health services.
So I know I have a lot of questions that are stirring in my mind. There's a lot of stigma that's attached to mental health. And what have you found in terms of the folks that you're able to help? Do they very much see that in sort of the Hispanic and Latino culture, that how is it seen for them to be able to get this type of care? Is it looked down upon? I guess what other stigmas are attached to it?
Yeah, so there's more stigma in the Latino community within Spanish speakers. Our community is behind in terms of just being able to realize that the challenges and being able to seek professional help. I think we're behind other communities, but the thing that I would say is that we're also riding the same wave where people are realizing the importance of mental health, and realizing that mental health is as important as physical health, and a lot of people have been opening up about it at at workplaces, even like celebrities like J Balvin, Selena Gomez, from Latino communities opening up about it as well. And so yeah, I'd say we're behind, but riding in the same way. Traditionally, this community relies more on family, on religious organizations to like work on these challenges rather than seeking professional help.
So when it comes to someone seeking a professional that speaks, their native language, how have you been able to, I'm just thinking about this from a clinical standpoint. What is there tension between clinicians here, in the US versus ones that are being able to treat these patients that are non-US? Can you kind of talk about how you had to sort of traverse those challenges, and how is that perceived?
Yeah, so it's something that has been going on for a while, and when I was asking around to other friends, and when I was like just having challenges of my own to find someone to talk to, and then I realized that there were many people that were already talking with someone from back home, but there is no straightforward way to do it, and that within itself there is like regulatory complexity, and but just like a big gap that hopefully we can close one day, right? So actually, a lot of our clients are already looking for this, are already thinking like, I want to talk to someone that is based in Latin America, and well, likely they want to have their sessions in Spanish. But not only that, it's also the fact that someone back home, or with that understanding of how they grew up, are gonna have like that, like a baseline of understanding where they're coming from, and I think that understanding and those initial matches between the provider and the client are super important, and are going to be very good predictors of better outcomes, and that folks stick around with services longer as well.
How many mental health professionals are there in Latin America? I had no idea that is there a large portion of folks that are clinicians in Latin America?
Yeah, it's a big pool of clinicians, and I'm not gonna have the exact
Oh,
number,
you
but I
don't need to,
know
but just
I don't
curious.
know. I know Argentina, for example, is a country in the world with more psychologists per capita, and
Really?
so yeah, in Argentina, it's really common to talk about mental health, to go to therapy. Uh, People just like there's no stigma, and and yeah, so a lot of talent there, and that's why after finding mental health professionals in Mexico and understanding the landscape in Mexico, we decided to expand to Argentina earlier, or well, last year, and we've found success in doing that as well.
Tremendous, tremendous. And so clinicians that are on the platform, how do patients typically find you? How do they sort of get access to these types of services? You mentioned they were looking. Where are they looking?
Yeah, so most of our clients right now come from our direct to consumer model. We also have like a more B2B side of the
Sure.
business, but the majority of the business right now is direct to consumer. And a lot of them come from word of mouth, actually, because they're, it's not something that you're gonna go post on social media many
Yeah.
times, but that you're using these services, but you're going to recommend it to like two or three very close relatives, friends that might start using the services. So there's a lot of that going on, and yeah, we also run ads on Google, on Facebook, on different platforms like that. And then we've done like other things like incentivizing those referrals, and we've been featured in other places, in the news and things like that. But the yeah, the more like the digital ads have been what have worked best.
And what have you found is like aside from, you mentioned language is important, and there's only, you said 5% of clinicians in the US that are Spanish speaking, yet 13% of the population is Hispanic and Latino in nature. So there's that big gap. Talk about the financial gap. I mean, what are we talking about here? Is it also just that someone who speaks Spanish here in America? I mean, are we talking it's just financially not doable for someone to go speak to them? I mean, what's the magnitude of the difference financially that we're talking about here?
Yeah, there's also part of that, um, and I can divide our client base in two. So one, um, part of them are coming because it's an alternative, and just something because they do not have access to these services, right? It might be
Right.
the financial barriers. It might be just that they are, working too much and don't have the time, that there are no resources for them, uninsured, underinsured. So just an alternative where they can, actually get services. And then another part of our clients are people that have some sort of coverage, maybe through work, but still want to use our platform because of the language and the cultural component. But yeah, like the gap that you mentioned, it is very likely that someone that is a Spanish speaker in the US, and it's going to be, in lower, socioeconomic bracket, and yeah, so the there's an access problem, and there's all of these health equity initiatives to try to bring up marginalized community up to the levels of other communities. And but yeah, so the both a percentage of uninsured population, like Latinos are going to be highly represented there.
Hmm.
So it's not only like the stigma, but it's also like the lack of of resources and coverage by insurance, that um, affect this community.
Interesting. So let's talk a little bit about the tech. How do folks sort of engage? Is it just via an app, and what's the platform like to the degree that you're able to share?
Of course, yeah. So it's simple. So people go on the website, they are going to see live availability of the providers there. We have next day availability. We have availability at, like early in the morning, late at night, weekends. So it's accessible. People are a few clicks away from scheduling their first session. And we also offer a 30-minute initial consultation where they can, for $20, where they can actually meet the provider, ensure that they feel comfortable, and start getting into what's bringing them there. And yeah, once you are able to schedule, payment is going to be through the website as well. You're going to get automated emails and reminders with the links for your sessions. Sessions happen over Zoom, and then there's to schedule your next session. We also offer different options. You can go on the website again. You can do it through your provider. You can get call customer service or get in touch with us. So
How
trying to
long
make it
does
really accessible.
how long does someone typically remain on the platform? How long do they typically see from what since you've launched? Clearly, you've had lots of sessions that have occurred. What's the typical treatment time, or is it ongoing?
Yeah, so we actually have great engagement. So on average, and it's going to be big average, they stay for more than 8 sessions. Which when we go with folks in healthcare and we talk about that, they're surprised because this is really remarkable, especially when they are paying out of pocket for these type of services. So yeah, so that's really strong engagement, which means that this is resonating with the people that are using it.
So it sounds like your D2C is the main driver of the business, and you talked about some other things that you're working with, on the B2B side. Can you maybe share what you and the team are thinking about on that segment of the business?
Yeah, so we're trying different things and kind of in this exploratory mode. We're trying to find the next archetype that is going to be next archetype of client that is going to take us to the next level. So talking about what we do today, we work with community-based organizations that are able to pay for our sessions and then provide them to their stakeholders. A lot of them are nonprofits that support the Latino community, and they are many times in more rural areas where this problem about a newer Spanish-speaking population arriving, but not Spanish-speaking providers, this issue is more acute in those rural areas. And yeah, so that's the clients that we currently have. We've also done work with Google as an enterprise customer, and yeah, what we're looking to do next is integrate more into the healthcare infrastructure. So thinking about how we can help, folks that might have, or providers that might have long wait lists for Spanish-speaking services, and then be, like we could triage and send folks that are a fit for our service our way, and then that way, you get through that wait list and have visibility into the people in there and what they are dealing with. And yeah, so we last year we received investment from the California Healthcare Foundation, and
Nice.
out of their innovation fund, their objective is to work with companies that either already work with Medicaid or have the potential to work with Medicaid in the state of California. So that, yeah, that's big for us, and we're exploring that option of being able to integrate within the Medicaid infrastructure in California.
You as a CEO, you're obviously thinking strategically, peering into the future. Where do you see some of the biggest risks, for the business?
Yeah, so I mean, as a CEO as well, I have to, make sure that the company is in a financial good position. And the last few
Yeah.
years have been tough to raise for direct to consumer health tech businesses in general. And we want to become more B2B, but that also like takes a little time, and like sales cycles are long, and
Yeah, we all know
it
that
is,
too well.
yeah, so those things taking too long, it's a risk, and we're a startup, and running out of money is a risk as well. And so yeah, and yeah, healthcare is a complex uh, industry to be in, and just for those to be in, like building a tech company, and just
Do
there's
you see yourself as more of a tech company, or do you really see yourself as more of a services enabled tech company?
yeah, so tech enabled
Yeah,
services company right
yeah,
now, but we want to evolve to be able to build more technology. And I think what's happening with AI is super exciting, and I think it's very applicable for mental health. I think there's going to be a lot of development, so we're already thinking about starting with what we can offer to our providers. So for example, an AI chatbot that can manage the logistics of them scheduling their next session, changes, things like that, which we already do, and like creating tools for them, and using all of what's going on in AI. So that's exciting. And then obviously with we've seen like companies doing AI note taking, and
right.
helping with more administrative burden that providers have. And so yeah, so tech enabled company now, but like we want to move forward by building more technology.
When you're thinking about partners on the B2B side, who's an ideal partner? Who's an ideal partner for you to be working with alongside and building together?
Yeah, so we've had good conversations with FQHCs that have a large percentage of Spanish-speaking population. And what we've noticed is that they normally have a very long wait list for mental health services.
Yeah.
And yeah, and sometimes they even work in a value-based care system where like having a long wait list and not actually knowing what's going on. Like there are things that are preventable before they become an ER visit. So it makes sense to offer more preventive services in the front end, and having people of those wait lists. So yeah, as I mentioned, we're thinking of this model where they can triage, send some people our way who are a fit for our service, and then they have visibility into their wait list, and actually also save money when they're working on value-based care. But yeah, FQHCs is a good one. We're also exploring EAPs that have a presence in Latin America.
Mm.
And yeah, like in the EAP space, we're also having interesting conversations. So we'll see. We're in that exploratory phase, and maybe in the it's
It might
going to be
shift. Who knows?
something
You never know.
totally different. You never
Yeah.
know.
What is as you've been on this journey, I mean, what has surprised you most?
I think um, that I mean, people always say like, oh yeah, it's really hard, but it is yeah, it is hard. Like things don't go as planned, but then there are other things that actually happen in the meantime, and they're really good. So like when you're, yeah, kind of like the unpredictability, I'd say, and the unexpectedness of everything, because you start with an idea, and then so like in our case, like started very direct to consumer, right?
Yeah.
And now we're more and more looking to be more B2B and find partnerships, and just and things change along the way, and and then the things that you're expecting that are going to happen don't happen, but then something else really good happens. So that, like,
Yeah, I think
unpredictability, yeah.
it isn't for the faint of heart. You need to have some thick skin because the highs and lows are there. Talk about that. Talk about, as a founder, your mental well-being. How do you, because look, a lot of maybe your peers that you went to business school with, maybe didn't take the road of entrepreneurship. How do you stay mentally well aside from, talking to someone? Presumably you're not only
Mhm.
just a founder of Sanarai, but you're also a customer. Um, how else do you kind of keep that level-setted mindset just to stay healthy as as a founder?
Yeah, so having a support system is always important. So I have it in my wife and family, friends, and taking care of yourself in terms of finding activities that you enjoy. It can be working out and being with friends, concerts, things like that, and taking, yeah, not feeling guilty about not working all the time.
Yeah,
Which is hard because this is your project. This is like the thing that you started from the ground up, and you it is important, and you're thinking, like, in the back of your mind, like, well, what is more important than working on this? but yeah, just finding time to be able to disconnect. It's also difficult to do, but
yeah,
advisable. And and yeah, I think those things, and yeah, not always thinking, like, um, putting so much emphasis on how, like, your company is your life, and that's the work, and kind of like trying to separate your personal life from your
yeah.
work.
There's something to be said about if you just only place your value in how well the company is doing. I can tell you that that's actually not a winnable game because there's going to be some ups, there's going to be downs. So I'm glad you brought this up just to talk about how you can create that level of separation, and to also even just have a level of connectivity outside of the business. And I say that because there's been a number of, I'll just say, um, in the public eye, founders and CEOs of emerging companies that have stepped aside, that have stepped down. And um, yeah, my concern is that the rigor, the mental capacity that it takes to take something from nothing to something is substantial. And if you're not taking care of yourself along the way, they could have catastrophic impact, not only on you physically, mentally, emotionally, but also to those that care deeply about you. So I'm glad that you've sort of shared some of the things that you're doing to stay steady, to stay, present.
Yeah, of course.
And so how can folks, I know we're kind of coming towards the end here of our conversation, but how can folks keep track of the things that you're doing, that the team at Sanarai is doing? Give us like a little commercial of how we can keep up to date with you guys.
Yeah, so our website is sanarai.com. You can follow our social media, and and yeah, LinkedIn is always a good platform as well to follow our updates. And
Amazing. Well, we always ask this one last question is, with our community, we ask, how can we support you? And from that, what action item would you suggest? What's one thing that, we can do as a result, whoever's tuning in and listening. So what's something that we can do to support you? And what's one action item that someone can take as a result of listening to this?
yeah, if this resonates, if there are things that could come up, or if someone would like to get in touch, and just reach out. We'd love to connect. We'd love to get feedback and talk more about what we do, and yeah, and just share more with people, and get to know folks in the healthcare industry, and that reaching out and scheduling some time would be great.
Awesome. Well, Luis, this has been fantastic. And for those that have tuned in, if you found this conversation enlightening in particular, we'd love to know, how would you feel about it? Comment around it. Leave us a note, like it, share it. That would be really, really helpful. So until the next conversation, Luis, thank you for coming on. And obviously the door is always open for you to come on and share more.
Thank you so much, Michael. Have a
You
good
bet.
one.